to be for somebody else that they're stuck in an emergency situation and then just scrambling around looking for somebody to go to.
Okay, we'll get to how it works because I went through the website and I saw you have different practices from different fields in medicine. So you go there. If you're looking for a dentist, for example, you click on the dental portal. If you're looking for I don't know how to say this word, anesthetist.
Anesthetist, yeah.
That one.
Yes.
You click on that one and so on and so forth.
Yes,
okay,
that's
fine.
exactly how it
Chiropractic
works.
and all that.
Yeah, we have all specialities, and we make sure that everyone that's registered on our platform is on the current Doctors and Dental Board.
All right.
So they're on the retention register.
Good
just
stuff.
to make sure that's all approved.
All right.
Yeah.
Startup Suit, how was it born?
So Startup Suit is a product of Brainverse, and Brainverse vision is to create products and solutions that would work for business owners. So Brainverse actually works fully remotely for the past 4 years, and the journey has been trying to find a solution that would actually work for them. And so you try out one product, a productivity doctor, you figure it's very expensive, you figure trying to get your team on one platform and collaborate on that platform is hard. The fees to actually give people like pay-per-use, it's a lot of expenses. So what we did was now, by the time March came, we had kind of found something that would work for us.
All right, so this
And
is
then-
March when the pandemic hit
So when the
Kenya.
pandemic hit, we're like, okay, we actually have something that is working. So many people are going to actually have this problem with regard to transition. So how do we help them and have it affordable in terms of now you're getting hit and you don't know what to do now. So how do we transition you to a remote team and ensure that you still are able to do your dailies?
So I'm looking at these two platforms, starting of course with yours, is the idea was there even before the pandemic. Did you foresee a situation, because we know the coronavirus started in China sometime in November or December of 2019. So did you guys do this in with that in mind? Because we watch all these movies, The Walking Dead, where we see zombies all over, and you're like, what if this actually happens? Or was it just sheer luck?
Actually, I don't think it was made because like we were anticipating that something would happen. The first positioning was to allow people to work remotely, because millennials and Gen Z are people who actually can work very efficiently from anywhere.
Right.
So how do we enable them and enable business owners right now, especially in the economy right now, that people probably would be working different jobs to actually start a business. So how do we enable them to actually be on top of the game so that even when it grows, they're able to now step off and take charge.
And then now when the pandemic finally hit, you guys were like, here we go, here we go.
This is
Did you start calling up people and like, wait, singly one bake it itafanyika? Or was it like, guys, this is what we have been waiting for?
No, it was more, this is how we are going to help. This is how we know that there are startups right now that people are really trying to figure out how to move, and especially now there's no money flow and all these things. So how do we help you guys? So right now we're even partnering with incubation hubs to give startups the platform for around 6 months to just for free to just figure out how to get that going for them.
Okay.
Yeah.
All right. Dr. Tanvi, for you, you said 3 years ago you were in a situation, and from that situation this idea was born. 3 years you've been working on this. How comes we're getting to hear of it now?
Yeah, absolutely. So we've been trying to really push the platform. We started with private healthcare facilities and private doctors, but it was really difficult trying to get them on to use an electronic platform. They've been paper-based for so long. They're used to booking appointments on a paper diary. They're used to their records. So was there a need to go digital? They've been doing this for years. They're seeing their patients. They don't need people to know they're out there. If people are looking for them, they'll find them.
Yeah.
And then around, I think mid last year, beginning to start to mid last year, they started realizing that people are looking online, people are asking questions online. And so more and more doctors started to get onto the platform. But yeah, I suppose COVID, people realize that, what are we going to do? Like everyone's too scared to go into hospitals or clinics.
Right.
Like even for non-communicable diseases, for example, if I just have like hypertension or cardiac disease and I need to see my doctor regularly, but I'm too scared to step into a clinic. Like what if I contact COVID?
Yeah.
So that's when they realize that actually we need this. And I suppose that's why, it's become more popular. The other thing was that we started in the private, but the public health was, they really needed our system, and we've been trying to push it out for so long.
Wait,
see,
who needed your system?
The public healthcare facilities as well. Because you have a lot of specialty clinics like maternity, gynecology, pediatrics, just all sorts, neurology, whatever it is. And these are clinics that patients know they're going to go to. They're predetermined appointments that are going to be booked, right?
Yeah.
So why do they have to walk in? Why is it a walk-in? Why can't it be a pre-booked appointment?
Okay.
The private healthcare works like that. Why can't the public healthcare be like that? Why can't it be a pre-booked appointment? And that's when it started working actually in January. So before COVID hit us,
January of 2020.
January of 2020, we
right.
got some hospitals that started using our system.
Public hospitals?
Public hospitals.
Government hospitals?
No, not government, sorry. The likes of, I suppose, missionary hospitals.
Okay, all right.
So not government, not public, not private though. They still worked on walk-in. They worked on the mass public coming in, NHIF accredited. But they saw that for speciality, they could have pre-booked these appointments. So the doctor's aware, how many patients are going to come today.
Okay.
The patients come in at the specific time. They're not seen, so and they still take walk-ins.
Okay.
So let me give you an example, like gynecology. The people think that they're going to be seen first if they walk in at 7 a.m.
Yes.
And
That's the thinking everywhere.
Exactly, that's the standard. But if you have 10 people walk in at 7 a.m., I mean, the doctor's not going to be there at 7 a.m.
Okay.
The doctor probably comes in at 9 a.m. So you're going to be waiting all that time anyway. And they write a list. Okay, so for
First
example,
come, first serve.
Exactly, first come, first serve.
Yeah.
But so you have a list of like, say, 5-6 patients. And then, so you're told, okay, you have 5 patients ahead of you, but you don't know how long that's going to take. And 5 patients ahead of you could take if you're looking at it,
could
like
take 5
20,
hours.
exactly,
Yeah.
or like even if 20 minutes each, it's going to take at least 2.5 hours, right?
Yes.
So at least this way, they're slotted in at time slots.
Okay.
And then they're told, look, there's 5 patients ahead of you, but that means you're going to be seen at 11 o'clock. So you can go.
You can
come
in
back.
at 5 minutes before you.
Exactly.
Yeah.
And then
Okay.
you'll be seen around at least within half an hour of you walking in. But that started working in January for us. And then
Okay.
COVID hit, and obviously all the social distancing and everything else was supposed to come in and work. And we had a working platform.
So you said that on your platform you have doctors that are accredited, they're on the list of the KMPDU.
Yeah.
Do you have all doctors there, or
Not
is
all.
this specific doctors who've subscribed to the Daktari?
That's right. We have specific doctors who've subscribed to the Daktari.
All right. And is it a nationwide thing, or is it just in Nairobi?
It's a nationwide platform.
Really?
Yeah, it's a nationwide platform. Obviously, it started in Nairobi, and we wanted to grow out much earlier. But we were really, really struggling to get doctors to come onto the platform in the first place.
Okay.
But we've gone nationwide now.
All right.
Yeah.
We'll be talking about the money implication on that one, especially for you, how the investment part of it and how it came about. But for you, Venetia, let me ask this. You must have met challenges, because what I'm looking your website to be is a place where people can sort of like meet other people and interact and probably share ideas. But there are very many other platforms like that one. What makes yours unique?
Exactly. I think that was the first challenge with regard to product. So I'm going to break it down. There's product, and then there's like now the management. So there's like the finance bit, and there's where do we get the infrastructure, where do we get the HR resources and the technical IT people to actually work on the platform. So that was one challenge. But also now with regard to, there are very different platforms out there that would actually do the same thing that we do. So how do we position it in a way that would work for us and would be able to work for everyone else? Because then at the end of the day, someone would ask me that, but there's a free website or a free platform, why would I jump on yours? And my answer would be, you're not my target client. Because the target client would be the person who literally knows this is a Kenyan thing, and we are growing with them, and we are actually listening to them and growing with regard to what they have. Because at the end of the day, you have to figure out even the customer journey. A Kenyan would come, I would give them a demo, you'd take them through it, which necessarily would not be the case on a different platform, that they would just, the model would be they know that people actually know how to use these things, which is very different here. So how do we move in terms of now approach? So the conversation for me shifted from actually getting people to say that this is the best platform, because there are very many, to now approach. How do I approach them, and how do I make them feel like this is something that is going to grow with you? If you actually want something done, if you want a task way to, like, if you want to report your tasks, how do we make that happen for you and your startup?
So apart from, you guys having done an interview in the papers and now you're on TV, how else do you get people to know you, to know that you actually do exist? Is there a marketing strategy, or is it, do you do sponsored tweets or sponsored posts on Instagram? How do people know that you guys even exist?
For now, it's basically referrals. It's very referral based, and trying to figure out who exactly are the people who we would want on this platform. Because at the end of the day, it would make no sense for me to tell everyone, and then I figure at the end of the day, these are not the people that are the ones. Because then at this point, we know that there are people who are working remotely because they have to work remotely, and there are people who are working remotely because they actually would want to explore the options of remote work and see how that affects their expenditure.
Okay.
And so finding out the best people, and right now we're working with incubation platforms and seeing how that would actually work.
Yeah.
And just listening to them.
Yeah. So who would you say, apart from the fact that now you get referred to this person and this person, and other people go and say, hey, by the way, you can reach out to Brainverse. They will introduce you to, the suit and everything. How do you determine then your target so you can know that this is the right person?
For me, I do a lot of testing. So I'll figure that I'll go to like this industry, service industry.
Yes.
The first thing that I know is the setup suit would work for people with very many projects, and not necessarily someone who has one project or two projects, but they have very many things that they'd want to see working.
Right.
And so that is the first thing that I would first look at. The other thing would be, I do a lot of tests. I try out with someone who's in the financial space. I try out with someone who's doing the service, who's in the service industry, and
creatives
see, and see. So the challenge again would be not creating something that is all-stop shop for everything. But finding something again that would just work for the people, and because I'm not going to build a platform like Zoom. Okay. I'm not going to build a platform like Teams. Because there's that. So how do I integrate my solution to be able to feed off all the others? So like use Slack or use Teams at the end of the day. So you're using our platform to project manage your people as an essence basically of the platform, and then all these other things that come, HR, CRM, and all this.
Yeah, okay, so you guys are solution-based basically.
Yes.
Awesome stuff. Dr. Tanvi, looking at also your platform, it's solution-based because if I need a chiropractor right now, just get onto the daktari.com, head on over to the Daktari tab, and then I'll find a list of doctors probably in my area that I can reach out. But it must have taken time to build such a platform. And you're saying that you've been perfecting it over, 3 years now. Yeah. What is it a lot of work?
It's difficult. It's difficult. We've made sure that we see the doctors ourselves. As the founders, we make sure that we do it ourselves. We make sure that the management is the ones seeing the clinics and making sure that, that it's right. And, like I said, the pickup only started last year. Before that, why should we do it? We had a lot of competition that was in the space as well. Right. A lot of people left because they didn't see that there was a need. Doctors honestly didn't see there was a need.
Wait, there are doctors who came in and actually left?
No, competitors.
Okay.
Yeah, no, the doctors that we have are really there. And what they've seen is that we've really pushed for them, Obviously, before, I think there was an advertising law as well. You're not able to market yourself as a doctor. You didn't even, you're not allowed to keep a sign outside your
clinic.
Like you can have the one on the top of the shop or the clinic, but not outside the gate or something to say that, I'm here. There's a certain speciality that's here. For private doctors, there was, but it changed. It changed in 2018. And so that helped us as well, because we could actually say now that, this doctor is here and this doctor is there. And so, like you said, it's by location as well. So you're able to see, it's linked to Google Maps. So you're able to get directions, but they've really seen that there's a difference. And a lot of patients, a lot we see at night. In the middle of the night, somebody's sick with anything. They could be vomiting. And that's the time that we get a lot of appointments being booked on the platform, or people searching online and seeing. So the patients have driven that the doctors come on the platform, and the doctors have also seen that there is a need to be online, there is a need to be digital.
Now, for people who probably, is there a specific type of person who needs, who needs to probably get onto the website? For example, is it user-friendly? Can my mother use it? Can my grandmother who is illiterate, can she just get on? I know she can't read, but this is just an example. Can she get on there, you know, with her, you know, specs and you know, like, is it user-friendly? Is it easy to navigate?
Fantastic question. So we've developed a family module, which means that if I have children, obviously I would like my children to be on the platform so I can book appointments for them, so I can put my children on the platform, but I'm managing them. So it's using my phone number, my email address, but I'm managing their appointment. So when when I book the appointment for them, the doctor sees their name, the doctor sees their details.
Right.
Same for elderly. So my parents, I got my parents on my platform, on my portal, and so I can book for them. And it works the same for, we have an e-prescription module as well, and we've partnered with certain pharmacies. So what happens is, so my parents could be somewhere else, they could be in Kikuyu somewhere, right? And I want them to get a certain medication delivered to them.
Right.
So it's their address, that it's on my portal, and I can go in, we can do a teleconsult for them, and then the doctor decides these are the medicines that the patient requires. So then they write an e-prescription.
All right.
Send it to the pharmacy. The pharmacy picks it up and delivers it to my parents wherever they are. So it's a foolproof, you know, it goes all the way there.
Okay.
And so they don't need to leave the house.
All right, awesome.
So, yeah.
Literally working from home, as we were told by the president and the government, and that seems to work for a moment. We take a short break right now, but before we do that, let's take a look at our question of the day. Let us know where you tuned in from. You can WhatsApp us on the number on your screen right now. Let's get the conversation going. How has your business sense developed to the pandemic? How has it developed? What biashara you're doing? Online clearly is the way to go. Have you considered that you might actually need to get on this one? Even going forward, we shall look at the future of this particular situation. Do not go too far. We'll be right back.